Richard, if you had a blackboard and I was into teaching, I tell you, 100 times I will stand. Did you ever do that as a kid?
I did a lot of things as a kid. Still doing today, some.
Unfortunately, so did I. The blackboard and I got real
Sorry,
popular.
Jim.
Yeah.
Okay, so. Hey, Jim.
How you doing?
Good. Everybody have a chance to review the minutes?
Yeah, so approved.
Second.
All in favor?
Right.
Opposed? Motion carries. 81.
81 is a resolution to accept funds from the Health Research and the New York State Department. They awarded the Oswego County Health Department up to $687,346 over the next 5 years to strengthen the public health workforce and foundational capacities. I put together a small committee to handle this grant because it is really broad on how we can use these funds to increase staff satisfaction.
Good.
I'm gonna put it on the floor, so moved.
Yep, thank you. Any discussion?
Second.
I was gonna say,
Second.
sorry. Now,
I was reading the new resolution.
now, you mentioned something about me earlier, and the rest of the committee didn't really hear it, but that's neither there. Some counties are using this as bonuses.
Some are using it as bonuses to increase wages. It's pretty broad on how you can use these funds. One of the things that our county is looking at, based on staff satisfaction surveys that we put out in October, was they would like to be able to fill bottled water. We don't have that capacity with the health department for staff to fill water bottles. So we pay for water for now, drinking water. So we would like to put those in, kind of like what DSS did, I believe, Department of Social Services put in drinking water. Another thing we're kind of looking at, but we're not sure because we have to hit all departments and we don't want to make it just nursing, just environmental, is some kind of retention bonus or bonuses if you bring in a member that stays with us and puts in an application and we hire them, and maybe the staff could get a bonus for retention purposes. Thank you for that idea. That was you. So there's a lot of really positive things that will come out of this money.
Sometimes unrestricted funds are the most complicated ones.
Yeah.
You know,
Yeah, it's not
first reaction is.
spelled out, and that makes me nervous,
Yes.
especially when you're giving money away. You start mentioning that.
Right.
That can cause a lot of dissension in the workforce, because you do have a unionized workforce, and they all are expected to play by the same rules,
Yes.
get paid the same
Yes.
benefits, et cetera, et cetera.
Yes.
And then we supersede one employee, two employees over the others for some type of, and I'm not saying it couldn't be justified, but to a lot of employees, it's not justified.
Right.
And I don't want to be put in a position where I've got to defend that. I'm going to be very honest.
No, we'll work very closely with HR if we decide to move in that direction, which it hasn't been decided yet.
Okay. Any other comments, discussion? All in favor?
Aye.
Opposed? Motion carries.
Thank you very much.
82.
82 is a resolution authorizing budget modification to increase the capital project funds, capital project 134 for Silk Road. The budget mod would authorize CP 134 to be increased to $112,920 for annual maintenance. Silk Road falls under the jurisdiction of the EPA and operation and maintenance guidelines. This is an annual thing. This happens every year. They tell us what we need to do, and we just make sure it happens.
Do I have a motion?
So moved.
Second.
So was it last year or year before they decided not to come check
Probably during COVID,
during COVID? Okay. So.
which would not be unusual.
Any discussion? All in favor?
Aye.
Motion carries.
Okay. And then the last resolution, oh no, it's not. It's second to the last, is reclassifying a public health nurse position to a senior program health specialist. This is a 4-year college degree, and SUNY Oswego actually has the wellness management program, so we tapped into that so we can keep our graduating class from SUNY right here in Oswego County. Worked with HR and New York State Department of Health to make sure that this would be doable, and it is. This would not result in any increase to the total preventive salary wage line, therefore no budget modification was necessary. And this position is eligible for Article 6 and grant reimbursement through immunization and lead program.
Motion?
So moved.
Second?
Second.
Any discussion? All in favor?
Aye.
So AT4 was just passed out to you.
This is a resolution to establish a grant project for the Shade Slab Field Station upgrades. This is, I did talk about this in November when I was requesting ARPA funds. And it really didn't fall into the ARPA fund category. And 2020, COVID really forced cancellation of routine maintenance to the shed. So we would really like to do some upgrades. I don't think a whole new trailer is needed for the mosquito station. This is the mosquito station that's located at 3 Mile Bay Wildlife Management. New York State Department of Health uses it for training, and we do our mosquito counting there. So what we're looking for is to add a chemical storage unit, some new vent covers, luan and flooring, a new well, which is absolutely needed. The one that is there now is contaminated with E. coli. And then new exterior and interior lighting. So we're requesting $32,742 in unappropriated fund balance so we can complete these upgrades.
Do I have a motion?
So made.
Second. Okay. Discussion?
Yeah, how far away is it from the water district up there for this case? I have no idea. Where this place is,
It's
not
about
close.
5 miles into the woods, up around 3 miles.
Now, if you put a new well in, what kind of definitive guarantee we're gonna have it's not gonna turn that E. coli again? Because that area is a mess.
It's a swamp.
Yeah, I know that's, and the swamp's gonna be full of E. coli, unfortunately.
I don't have a guarantee. I couldn't give a guarantee.
I think, I'm not sure, but I think the difference is they want to drill well. I think it's a dug well right now. So they're getting surface water, I believe. I know people with my last name have been arrested down there for partying before, so I know where the place is.
We know where the E. coli came from.
Now, we're in high school, they've grown up since then. But yeah, I think that's what the deal is. But,
It is a very old well.
I think you always have that problem, but I would think if they go deep enough, they could get past that.
Yeah, I was wondering maybe it'd be better if we just treated what we had. Unless we're not getting the volume, but out there, how could you not get volume?
Well, I would think so, but they get a volume of E. coli, probably.
Yeah, that's an iffy question, or, situation.
Yeah, but if they've got a cover, if it's an open well, just treating it and getting it usable is okay, but then you should cap it somehow. Probably cost as much to encapsulate that as it would to put a new one in, probably.
I don't
I
know.
think so.
Good question.
I have
Yeah, go
a few
ahead.
questions. One, I have no idea what this site is, so
Okay,
I didn't party with Jim when I was in high school.
It's out in the middle of nowhere.
So what is this well servicing? Let's start with that. What is there a building?
yep, there's a building.
What is the building for?
It's a trailer where we have our microscopes, and New York State Department of Health uses it for a training station for E. coli and tick surveillance. Not E. coli, triple E,
Triple E.
Right.
West Nile, and tick surveillance.
And then, so we're talking about a trailer,
We are talking, yes.
and I'm just wondering where you got the price on the well at 16,000 because
B&G,
B&G, okay,
yes.
all right. And I'm okay. I'm good then.
So as a side comment, this was originally an ARPA request, and it was recommending that not go through ARPA, but go through
Capital project.
capital project.
And then why the delay in getting it here then? Why is it just coming in last minute?
I didn't know any better.
Oh, okay.
I thought the money was already in a capital project, so when we went to go look at prices and start making upgrades, we learned that I needed to request our
Okay.
capital.
Okay, fair enough.
Jim, just out of curiosity, what are you, Jim? This is for the public good. And that covers a lot of towns. You got Constantia, West Monroe, part of, that whole part of the lake area. Why wouldn't that fit under ARPA?
I don't recall the criteria and why it didn't.
And I'm just curious, I mean,
You gotta ask the officer.
Yeah, I just remember in the conversation that Vera was told that this fits capital project better than using ARPA funds. It's not gonna happen immediately anyway. We gotta set the project up, and then they can go through the process of trying to get it right.
And they're just starting to open it up so they can start doing training and getting ready for the mosquito season, which is coming.
soon.
Very soon.
Just for the record, the capital well, all they do is they take a big cement disc and throw it on the top.
That's what they would do.
That's all they do. Yeah, so you can't lift it up without a machine. It's very heavy. So once it's on, it's on.
Any other discussion? All in favor?
All right.
I,
Opposed?
Thank you very much.
Okay. Still,
The next is approval of the professional advisory committee meeting minute that was held in December. I did not see anything unusual in the minutes, and I'm just requesting approval.
we have to do a motion for that, so that everybody knows.
so many.
Okay,
I'll second.
second. Any discussion?
So there's nothing jumping out at you in this? Just
None at all.
standard Protocol?
The standard protocol.
Okay.
That it?
That's it.
All in favor?
All right.
I,
Opposed? Motion carries.
This one I also need a vote on, is the professional advisory committee. Meeting every year, we do an annual review in March, which is called our APE, or annual program evaluation. So the health department evaluates and looks at trends in service delivery, patient statistics, quality assurance outcomes. And we develop goals for the upcoming year. The annual performance evaluation is reviewed and approved through the professional advisory committee. So that, I did not see anything that stuck out.
Nothing stuck out?
And I was involved with the process of completing this. This is this. It's just the whole year of our nursing, health ed, and healthy families programs. And emergency preparedness is covered under that also.
Need a motion?
I do.
So moved.
Second? I'll second.
It's a killer sometimes, right?
It is.
it was a lot of information inside this program evaluation. It's all the good work that we've done.
As I get older, we'll have to have a little system. Oh, green light, oh yeah, second. Any questions, discussion, clarification? If you've been on this committee more than a year, this is not a surprise. We do this every single year. All right. Nothing? All in favor?
Aye.
Opposed?
Thank you very much. And my report. So on April 23rd, I sent out an email to all the legislators requesting all of you to take part of our accreditation process and requested that everyone fill out a SWOT analysis, which is an analysis that looks at our strengths, our weaknesses, opportunities, and any threats. If you have not completed it yet, please do it. Your opinion really, really does matter to us. You are the voice of our community. So if you could get that to us, that would be wonderful. You're one of two external. We did an internal SWOT with all of our staff and our management team. And then two external is our legislative body and our Board of Health. We're going to ask them to do a SWOT also. That will help with strategic planning to move us closer to accreditation. We are also starting to take our first steps in accreditation with our readiness and training program. That's about a 3-year program to get us ready for strategic planning, and it counts towards the accreditation process. So that's exciting stuff. We're working with Betsy right now. We need an approval letter from the legislators to support us going for accreditation. So that will be coming soon. Legislator Weatherup, I think you're the only one that needs to sign it, but I do need, but everybody has to be in agreement that the health department will go for accreditation. So that's coming. We're working with Betsy now. Currently, hospice has 25 open bereavement cases. Environmental, we're going into our busy season. We're already starting to receive paperwork on children's camps, and we're also receiving Harbor Fest applications for food vendors. 2023 Super Dirt Week is right around the corner, and the planning meeting, the first one of the season, will be held Tuesday, May 23rd. From January to March 31, we've had 11 new nuisance complaints, 6 garbage, 19 septic complaints, and 2 rodent complaints. We continue to work with our facilities that have a cooling tower. There's a total of 58 in this county, and we are at 67% compliance rate now. Last year around this time, we were around 38. So we've been working hard to make sure they get their data and their testing in. Rabies, we've had a total of 118 calls. 11 tests were done on various animals, and only 2 came back positive, and they were both raccoons.
Can we request some more bait stations to be put out that drop by the, is it Department of Agriculture that does that?
Yes,
Can we request that they do that again?
I will.
Because that rabies is consistently in
Oh,
Minetto, Granby.
It's all over.
Yeah, I know it is, but we get quite a few cases over there that are positive. I know it is all over. Yeah,
We have
Can't
some
hurt that.
problem on it.
yeah, do some more baiting, perhaps.
Yes, when they do the aerial baiting where they drop them, that's wonderful.
Yeah,
That does help.
it's something, right? Yeah.
Mhm. It definitely brings our numbers down, and we can prove it. So, yes. We had 2 rabies clinics that will be held in May. The first is this Wednesday, the 3rd, and that'll be at Pulaski DPW Garage. And the second will be held May 17th in Parrish at Del Tuckle Alley at their highway garage. We held our first FAST meeting. The FAST is the Public Health and Safety Team, where we look at how to prevent overdoses in this county. This is a co-led team with public health, as me as the lead, and then Shane Levine on the public safety side. It was really good. It was very well received. We had 26 attendants to the meeting. That included EMS, police, probation, district attorney's office, Veterans Affairs, mental health. It was actually really good. We know that there's a problem in this county, and we're taking steps to improve.
Can I ask-
Yeah, go ahead.
Do we keep track of how many times that we have to supply multiple doses of Narcan to an individual? Do we have numbers on that? Like how many times we gotta do it more than once in one day?
Like,
Well, because I guess at the last meeting, I brought up the fact that, if somebody attempts suicide, we watch them, we commit them for a few days, right? Somebody's got to keep an eye on them, they got to be cleared. But if a guy overdoses and you go back and you Narcan him a second time, perhaps we should have taken him the first time for observation instead of waiting for the second dose to be Narcaned again. So I'm just wondering what the rate is for that and why we're not doing that already. So I guess that's the.
well, it's difficult because of HIPAA. And the data that EMS receives is very difficult. So all that information has to be redacted, but we could go based on a zip code, would probably be the easiest way. And I did look into, we had that conversation about them refusing to take transport to a hospital. New Jersey does that. So that if,
They mandate that they go,
yes,
so it can be done.
it
There's not a federal
absolutely can
guideline
be
that
done.
can't do it, right?
Where they go, I have no idea. It might overload our hospitals or where, but I understand it for a safety. There's
Well, I guess my
definitely
point is, why is the guy who tried to commit suicide's life more valuable than the guy who overdosed, right? We got two people that are obviously not right in the head at that particular moment in their life, right? So maybe a little stay of intervention might prevent it from happening. That's my thought, that's all.
So,
I don't think there's a lot of clarity as whether that, I think Jersey, that's a state law.
it might be, I'm not sure.
So we would have to check into that and
Yes.
find out, where's the line, if there is a line.
And where do they go when we're not? Are we transporting them right to the hospital, or are they going to a mental health facility or a holding facility just so we know they're well and they don't overdose?
Most times when you take them to the mental health facility, they gotta be cleared through the emergency room first anyway. So
That's
that
correct.
would probably be the first route, and then from there, they could be rerouted someplace else. But I think even that, not allowing them to refuse, just mandatory, pick them up, take them to the hospital.
I know during
Walk out of the
COVID, our
hospital.
hospitals couldn't handle
I know
that
that.
amount, but
Really.
maybe now, yes,
It's,
Oh, it is, it's,
it's
But-
all, most of these, 99.99% of them are mental health.
of course they are.
Let's be honest, so they should be going to a mental health facility.
Yeah, but always you take them to the
yeah,
emergency room
emergency room
first
to
to be
get
checked.
cleared.
Yeah, you
Right.
can't, if you drop them off at a mental health facility and they die in the parking lot, or as you're bringing them in, you should have taken them. That's standard. You gotta take them to get checked on that.
If someone gets epi because they have an allergic reaction, the next step is emergency room, so it is a medication, at least to get checked out and cleared.
It's a good question.
It is. But I did look into it, New Jersey does it.
Thank you for looking at that.
This committee, though, one of the reasons this was formed was we have, I think, 5 separate committees set up to handle opioids.
There's a lot of committees.
It's
But-
overwhelming, because I'm on like 3 of them. And it's
Right, some deal with stigma, some
Yeah.
deal with, yes.
And the idea behind this was to try to round up some of them conversations so that there's a center point that people can begin to sort this out a little bit. Because it's the same people on all these committees,
Right,
and if you go to all of them, you're talking about anywhere from 6 to 8 meetings a month for 2.5 hours to hear the same information being reported by different agencies, so.
right. And another key piece to this is that the overdose fatality review, which will be set up by the health department to run, we will be the FAST will be the team they come to present their information. Because we are the major data hub. The health department, everybody knows, you think of the health department, you think that's where the data goes.
Right.
So that's really what we want to do, is centralize all that data so everybody can get a clear understanding of what we're dealing with.
Good.
That's all I have.
That's it?
I would like to make a motion, right, that we support, that this committee support the health department's accreditation process.
Absolutely. I'll second
Okay. Any discussion there?
that. And ready.
And
And
ready?
ready?
All right, I'll get the letter over to you. Thank you.
All in favor?
Aye.
Aye.
We need that in writing, Matt?
Yeah.
He's got it.
I
He's doing a good
can
job.
figure that out.
It's in the minutes there. But, you know,
So that's done.
Thank you very much.
that's a very important step because I've,
Huge.
asked a couple things at NISAC. I'm on public health, mental health at NISAC. And a county our size, that is not happening very often at all. For a county this size to be accredited is a major step forward, which could open up possible future grants
Yeah, yes.
Absolutely.
to dig wells and other places for mosquitoes. That's it? Do I have a motion?
So move.
Okay. All in favor?
Aye.
Anybody opposed? We're done.